All right,
There
so
you go.
this is
Great.
Healthcare.gov
Live.
live right now. So you can see the start page, as Marilyn talked about. You've got your login toolbar right up at the top there. So if you do have an account, you can just click there. But there is a nice tool here called See Plans and Prices. So if we click on that, all right, now we're just going to browse for our coverage options. So let's say you want to just get a nice quick estimate. So we're in Concord, so we'll type in our zip code of 03301, and we'll press Get Started. And then this just says, please note this plan is a preview and price estimator. It is not an application for marketplace coverage, so we'll just press Continue. You know, these details may change. And then, so now we're just going to enter our household income. So let's say we have an individual who is making, let's say, $25,000 a year. All right, for 2015, they expect to make that. And let's say that person is, let's say they're 31. Okay. And, you know, right here there are options to put, like, you know, are you a smoker? Are you a parent? Are you pregnant? Do you already have health coverage from an employer, Medicaid, CHIP, or Medicare? Let's say this person doesn't have any of these options, so we'll just press Add a Person. And then if there was another person in that family or household, we can keep adding those people. So if you have, you know, a spouse or children, you can keep adding them. But for our sake, we'll just do a single person. And so to do that, we'll just press Done with this step. If you want to remove people or edit, you can just press the Remove button and edit these people. So we'll just press Done here. And so now it says your estimated eligibility results. This household may be eligible for $82.04 per month premium tax credit to use right away to lower your monthly premiums. So that means that every month you would get $82 applied to your premium. So, you know, your premium is going to be lower by $82 there. You also may be eligible, as Marilyn talked about earlier, for the cost-sharing reduction on a silver plan that reduces the out-of-pocket expenses for deductibles, co-payments, and co-insurance. So now we can just continue to plans. We'll press that. And so this just goes to what Marilyn talked about earlier about 3 things to know about the marketplace. It covers all those essential health benefits that she talked about earlier, doctor's visits, prescription drugs, etc. So we'll just close out of that. So now you're into the plans here. So as you can see, there's 39 health plans up at the top here, and it ranks them by monthly premium. And you can also change this and do it by deductible if you wanted to. But you can see this first plan here is Minutemen Health, and that estimated monthly premium is $89. This is a bronze plan HSA. And you can see that for you're paying $89 a month, and it's for one person covered. Now it shows here at the bottom what it cost originally, which was $171. So because of your $82 that tax credit that you got, it reduced it down to $89. And now you can see that your deductible is $5,800. So as Marilyn talked about earlier, usually the lower the premium, the higher the deductible is going to be. And another thing to notice here is the estimated out-of-pocket cost. So with these bronze plans, you're going to pay a lower premium, but your out-of-pocket costs and your deductibles are going to be higher. And if we just, you know, there's a lot of tool buttons here. So on the left here, you can narrow your results. You can do less than you can find plans by the premium that are less than 100, less than 200. Oops. Let's see here.
Can you just scroll down and show them the summary
Sure.
of benefits there on the
Let me go
right-hand
back
side?
to, yeah, so if we just go back to this plan here, let's
There you
see,
go.
there we go. That's not the right, so by monthly premium. So here's that first plan that we looked at. So if we just scroll down here, it goes into the co-payments, co-insurance information, the summary of benefits. If you click that link, it'll take you to a document that will go to the summary of benefits. It'll give you the plan brochure, the provider directory, and this other button here. You can it'll take you to a page that will expand the plan information, and it'll talk about things like Are X-rays covered? What specialists? So, for instance, cost for medical care, it goes into much bit better detail for that. So, a specialist visit would be 10% coinsurance after your deductible. Routine eye exams are no charge. Prescription drug coverage. Access to doctors and hospitals, so you can go to those links there. Hospital services, children and adult dental coverage, medical management, and a lot of these other services that Marilyn talked about. And if you like this plan, let's say you go home and you start searching through these plans and you find one in particular that you like, you can say, like this plan, take the next step. And then great, you found a plan that you like, make sure you print it. And it'll just take you to the next steps here. So if you really like this plan in particular, you can create an account, and then that will take you to Healthcare. That will enter you into that process that Marilyn talked about earlier.